Well, good Wednesday to everyone. I want to start today by recognizing the 50th anniversary of Earth Day, a peaceful protest of millions in 1970 that is now one of the global community's most significant annual events. No doubt this is a very different Earth Day than we're all used to, but this pandemic has put us all face to face with how essential it is to have a holistic view of international public health. Though we can't march outside together this year, I encourage all Illinoisans to take part in honoring Earth Day, which you can do at home by participating in things like virtual teach-ins and digital outreach, especially on this Earth Day. Let's be all in for Illinois. On to today's update. As you know, more widespread testing is a key goal for combating COVID-19. It's a vital feature of our long-term path to building a new normal. Along that path, we need to make testing more available and convenient to more people. So I'm pleased to announce 2 additional state-run drive-through testing sites, both of which are available to anyone who has COVID-like symptoms and wants a test, even without a doctor's order. Today in Aurora, we opened a new drive-through at the Chicago Premium Outlets Outdoor Shopping Mall, located at 1650 Premium Outlet Boulevard in Aurora. That location can take up to 600 specimens per day. And starting on Friday in Rockford, we will open a drive-through location at the University of Illinois College of Medicine, Rockford. The address there is 1601 Parkview Avenue, and that location will be able to take 500 specimens a day when fully ramped up. Between these 2 new sites and our 3 existing sites in Markham, Bloomington, and in Harwood Heights, our 5 drive-throughs can run up to 2,900 tests per day when the Rockford test site is fully up and running. Again, anyone who has COVID-19-like symptoms, even if they do not have a doctor's order, can get a test at these locations. And this is the criteria that we are encouraging testing providers all across the state to follow as well. And in honor of National Laboratory Professionals Week, that's this week, I want to take a moment to recognize the hospital and private and public lab technicians across the state, especially those that support these drive-through operations, because these tests are just swabs until a lab professional turns them into results. These folks are a vital part of solving for our testing needs. To North Shore Hospital in Evanston, Reditus Laboratories in Pekin, Edwards Elmhurst Hospital in Elmhurst, Naperville area, Star Lab Corporation in Franklin Park, and many others, know that I speak for all of Illinois when I say we are so grateful for the work that you do. I also want to provide a brief update on our ongoing efforts to source personal protective equipment. We've now sent out more than 15 million items, including 7.7 million surgical masks, nearly 1.7 million N95 masks, over 30,000 gowns, over 6.4 million gloves, and over 350,000 face shields to locations all across the state of Illinois. We also have outstanding orders due to arrive in the coming days and weeks, with an additional 25.5 million N95 and KN95 masks, 25 million surgical and general medical masks, 8.4 million gowns and coveralls, 14 million gloves, and 7.5 million face shields and goggles. Finally, I'm proud of the people at the Illinois COVID-19 Response Fund, who have worked tirelessly to raise private funds and are providing grants to organizations on the ground in our most vulnerable communities all across Illinois. The fund has raised more than $30 million from over 2,400 donors since its March 26th launch. You may recall that earlier this month, the fund distributed its first $5.5 million to 30 organizations across Illinois. Well, today, the Illinois COVID-19 Response Fund has announced funding $4.8 million more for 18 nonprofits around the state. These are organizations providing people with access to food and shelter, health care, help with their mortgage and utilities, and focusing especially on supporting children and seniors, those with disabilities, immigrants, victims of domestic violence, and others. These are organizations that are truly carrying their communities through this pandemic, and I am so very grateful for their partnership. Individuals and families who are in need of support, or those who want to contribute, should visit the same website. It's ilcovidresponsefund.org. That's ilcovidresponsefund.org. So thank you, and now I'd like to turn it over to Dr. Ngozi Ezike for today's medical update. Doctor?
Thank you, sir. Good afternoon, everyone. And again, I echo the governor's sentiments and laud all of the lab professionals across the state who are helping us with this COVID response and with all the other lab tests that still need to continue to run. We are encouraging people to get tested, as you heard the governor say. More and more locations and facilities are starting to offer testing. Federally qualified health centers, or FQHCs, the mobile testing sites the governor mentioned, hospitals, health clinics, and urgent care facilities are all offering options. Testing will help us know just how widespread the virus is and what communities are being impacted most and where we need to target our responses. We already know some of this information through the testing that we have been able to do, but more is yet needed. Additional testing also helps further spread. Many people have only mild symptoms or even no symptoms, but they can still spread the virus as we continue to learn and increase our information about this novel virus. With additional testing, people will know if they are positive and then can take the appropriate precautions, such as self-isolation, which will help reduce the spread to others, including the most vulnerable. More testing is one of the keys needed to end this pandemic. As of today, we are reporting 2,049 new cases in the state of Illinois, and unfortunately 98 individuals who have lost their lives. This brings our statewide totals to 35,018 cases and 1,565 Illinoisans who lost their fight against COVID. At the end of yesterday, we had 4,665 individuals in Illinois who were hospitalized with COVID-19. Of those, 1,220 were in the ICU, and 747 of those ICU patients were on ventilators. Please allow me to continue to encourage everyone to do their part by staying at home, by wearing masks when outside, by washing their hands frequently, cleaning frequently touched surfaces. It's the only way we're going to get through this pandemic, as mundane as that may seem. Please stay safe, please stay healthy, stay home, if not just for yourself, but for others around you. And with that, I will translate comments into Spanish. Buenos tardes. Como dijo el gobernador, estamos avisando a la gente que se hagan la prueba de COVID-19. Más lugares en el estado están comenzando a ofrecer pruebas en sus comunidades. Desde hoy, los sitios de pruebas móviles, algunos hospitales, clínicas de salud y centros de atención de urgencia serán haciendo pruebas. Las pruebas nos ayudan a saber cuáles comunidades están más afectadas y dónde necesitamos una respuesta específica. Las pruebas adicionales también ayudan a prevenir una mayor transmisión del virus. Con pruebas adicionales, las personas sabrán si son positivas y pueden tomar precauciones, como la cuarentena, lo que reducirá la transmisión a otros. Más pruebas es una de las claves necesarias para poner fin a esta pandemia. A partir de hoy, reporto 2,049 nuevos casos, incluyendo 98 personas que han perdido la vida. Nuestros totales estatales incluyen 35,018 casos y 1,565 muertes. A finales de ayer, 4,665 personas en Illinois fueron reportadas hospitalizadas con COVID-19. De ellos, 1,220 pacientes estaban en la unidad de cuidado intensivo y 747 pacientes con ventiladores. Todos deben hacer su parte. Es la única forma de superar esta pandemia. Tenemos que seguir trabajando juntos, porque solos no lo haremos. And with that, I will turn it over to Governor Pritzker for questions.
Hi, Governor. Eric Hong with ABC7. Got a long list of questions from colleagues here, but wanted to begin with one of my own. The argument has been made regarding the stay-at-home order that the intention or the goal was not to eliminate COVID-19 by April 30th. That was never going to happen, but to buy time for the healthcare capacity to increase, for the ICU beds to increase, to get the ventilators and the PPE here, to get the alternate care facilities up and running, including McCormick Place. And credit to the administration, a lot of that has been accomplished in a short amount of time. So the argument has been made that because the healthcare capacity is in a much better place right now, and because of the curve and the peak maybe coming later and lower than initially projected, why not open things up after April 30th, just in a slightly more robust way than you've so far indicated?
No, I appreciate that question, and I think people need to understand actually the principal purpose of the stay-at-home order was to make sure that fewer people got sick and fewer people would die than would otherwise without a stay-at-home order. And as you're suggesting in the last part of your comments, the curve gets pushed out when you do that, pushed down, and that's good because as you're trying to build capacity, you're trying to raise the line, that you don't want to go above, right, of how many beds do you have, how many ICU beds do you have, how many ventilators do you have. You want to raise the line so that you can fit all of the patients and the needs underneath that line of capacity, let's say. And you want to continue to make sure that wave of patients doesn't go above the line. You don't necessarily need to continue to build capacity, right? We can't build out 4 more McCormick Places. But what you want to do is make sure that the number of people who get sick is kept down. And so that's really the purpose of a stay-at-home order. It was the purpose of the original, canceling of, as you may recall, canceling of, the parades and St. Patrick's Day parades, and then closing of restaurants and bars. So that's what I think people need to pay attention to now. Obviously, the better we do at this, right? The better we do at this, the more likely it is that we can start to think about, okay, what are the safe ways to begin to reopen things so that people can go back to work, people could go back to school. Are there ways to do that keep people safe? Some of the things we've suggested already, like everybody wearing a mask, are some of what's one idea among a bunch that will help us get to keeping under the capacity and making sure that few people as possible get sick.
I think most people understand the need for avoiding a resurgence of the virus. Is there a scenario in which you can open up the economy without there being some increase in cases and fatalities? Or are you going to have to make a very difficult decision in terms of balancing an increase in order to avoid creating dire harm to the economy?
Well, I think I've foreshadowed for everybody, and I think it's widely understood that the things that you need in order to open the economy are things that we don't quite yet have in place, nor does any state. Some states are reopening anyway. That's their choice. I think people might get sick. Many people might get sick as a result of that. But look, what have I said, right? Testing, tracing, treating, and PPE. And while we're working very hard on PPE and testing and spinning up a contact tracing effort that will be very large at the end, those are three things that we have to work on. We're not there yet. You know, we've talked a lot about testing. We're just not there yet. And so having said that, you can make tweaks and moves and, you know, as you move along here and as we learn more, remember the researchers are learning things as we go too. Nobody was saying everybody has to wear a mask at the beginning. Nobody was saying that. Now, that's pretty common understanding among the epidemiologists and others that, you know what, it makes sense if you're going to be outside and, you know, each of you wears you don't have to wear an N95 mask. You just need some face covering because it's your droplets that you don't want to convey to somebody else and you don't want them conveying it to you. So once again, all these things are going to be kind of the new normal going forward and allow us to do things to loosen things up and begin to, as you're saying, reopen the economy.
A follow-up from my colleague, Sarah Schulte, who asks along the same lines, you know, but at what point, though, does the human cost of keeping the economy closed, the health problems that arise from joblessness, et cetera, outweigh or are commensurate to the health cost of COVID-19?
Obviously, these are things that I weigh every day and I think about all the time because I understand that it's challenging for people. There's a mental health cost, you know, in addition to financial cost. For everybody. There's, you know, this is going on, it's having an effect on everybody. And so I like everybody, I want it to, you know, to be back to normal as fast as possible. I think we're all recognizing that normal is going to look a little bit different going forward until there's a vaccine, until we can literally rid the, you know, our state and our country and our planet of this scourge of COVID-19, things are going to be a little bit different. I think we're all going to have to be a lot more careful. And while we're being careful, it allows us to begin to open things up more as long as people are in fact being careful.
Should we anticipate some iteration of a stay-at-home order until there is a treatment, until there is a vaccine, because that could be a year and a half?
You know, as you saw, there were different orders that we put in place over time, right? There was you remember that, again, we said no gatherings of a certain size, and then we said no gatherings of a smaller size, because we learned more. Then we said, you know, no, you know, restaurants and bars can't be open. Then we said we have to close schools. Then we said stay at home. Those are like, you know, that's a progression of things as we were dealing with something that was seemingly going to overtake the healthcare system and going to make people sick and more people would die. And so as you realize that, you say, well, okay, well, what's the progression of things as we all have learned that wearing masks helps, that, you know, fewer people in a space, you know, gathering together helps. What have we learned from all that helps us reopen the economy? And that's where we are now, right? We're all looking at that. Now, mind you, I just want to remind everybody, we are still adding more people to our hospital beds in the state of Illinois, even now. We're adding more people to our ICU beds, the number of ICU beds that are filled with people. These are things, you know, you don't want to be on this side of the, you know, of the curve. And so we have to get past that, and I think that's what we're all aiming at, and those are the things, I told you all the things, I've been, I think, pretty transparent about the way I think about all these things, and the fact that I want very much to find the right balance, as Sarah is suggesting.
I got to move on. Chris Hush from NBC5. Can you speak to the situation? I think this is for Dr. Ezike. Can you speak to the situation happening at Lakeview Nursing and Rehabilitation Center, where the Cook County Medical Examiner has confirmed at least 8 deaths due to coronavirus?
So I am not the one on site at each of these outbreak sites, but I do know that we have a very targeted approach to all the congregate care facilities, including the long-term care facilities, where we are working very closely with the local health departments. We're trying to make sure that everybody has the adequate testing supplies to be able to do testing on site. We have made our state labs available for any of the nursing homes or congregate facilities to send the test the tested specimens directly to us because we actually are the fastest game in town in terms of the turnaround. And so we know the results of those tests are critical in order to make appropriate decisions in terms of moving patients. So we have the lab support that we're offering, as well as technical assistance in the form of our infection control preventionists, our UIC infectious disease consultants. We are on the phone with all facilities repeatedly trying to identify specific needs on site, sometimes by telephone, to identify, again, specific needs, whether it's education, whatever support that's needed, we're trying to offer it. Again, we are seeing these issues across the state as I talk to my fellow state health officers across the country. Unfortunately, this is not uncommon. We're seeing this as we predicted because of congregate care facilities and just the setup, but we're doing all we can and hoping that we can get all of this under control, but testing is a big part of that as well.
Dina Rebick from WGN. Yesterday during the White House briefing, Dr. Birx mentioned New York, New Orleans, and specifically Chicago were doing, quote, much better. Do you agree with that assessment, and how closely is your team consulting with the federal government on modeling and determination of the peak?
We are indeed doing better, and I want to make sure everybody understands. And look at New York, right? I mean, they've seemingly flattened their curve, but it's flattened at a reasonably high level. But flat is way better than than the direction that they were going. And the same thing is true in Louisiana, and the same thing is true in Chicago. So I absolutely agree with things are better. And so that's a very good sign of how the direction that things are going. I'm sorry, the other part of the question was?
I think in essence her question is you have your own team determining modeling and determination of the peak. Is the federal government weighing in? Are you consulting with them on that?
They are not using seemingly the data from Illinois, as far as I know, and they have not offered to help with our data or with our, estimation of our curve. They, in fact, were for a long time using that public one that others were using, the IHME curve, which is inaccurate as regards Illinois. For example, they show a much lower number of hospital beds on their site than we actually have. So it's very hard to, and they don't have the data that we have for whatever reason. So I would say, that what we have and the experts we have here are what we need, I think, to get good modeling. And there are a number of institutions that have modeled Chicago, Cook County, and the state, and we are looking at those.
From the ABC7i team, VA records show that hundreds of veterans in Illinois have tested positive for COVID-19, and at least 18 have died in VA care. Have you been in touch with the U.S. Veterans Administration regarding the growing number of cases at their facilities in our state? Is there anything the state can do?
I think I'd like to turn it over to the doctor to talk, but I just want to say, though, the VA has actually been it's a side note to the question, so the main answer will come from the doctor. But I mean, they have been very helpful in offering hospital beds from the VA for COVID patients that may need to use those hospitals. Again, it's more than surge capacity; they're real hospitals, full-on hospitals with full staffing. So I just want to compliment them on having offered to us their federal facilities, which aren't normally available to non-veterans.
So, of course, to highlight what the governor said, yes, we're already in conversations with the VA. We already have the connection with several of the VA facilities to expand and use hospital beds and ICU beds, and they even said that above the initial beds that they've offered, should we need, they can expand even beyond that. In terms of veterans contacting COVID-19 and having severe consequences, there's no one that's immune from this disease. So we're seeing it in every group. So unfortunately, there's no way to prevent it in any specific demographic, any class of citizen here in Illinois. So we're seeing it in veterans, we're seeing it in homeless people, we're seeing it in nursing home residents, we're seeing it in healthcare providers, teachers. So there's no setting, there's no type of individual, there's no part of the state that has been able to have some kind of immunity to this situation.
But is there anything that the state can do at a federal facility, either to step in or to aid the efforts there?
Yeah, so we don't provide direct care in the VA facility, of course, and even when we give these non-veterans and allow them, when they have allowed us to put, our patients in the VA, I mean, that's a partnership that they're entering with us to be able to provide additional service. So we're grateful for that. We're not the ones directly treating in those facilities. They're independent, obviously, but we're happy for the collaboration, we're happy for the cooperation, and grateful that they can provide additional capacity to us.
Okay, Jim Williams, CBS 2. One of our unemployed viewers says that she's tried getting through to IDES, quote, hundreds of times without success. She finally reached out to the governor's office, and the matter was, in fact, quickly resolved. Would you recommend that other frustrated unemployed workers contact your office as a last resort?
I certainly want to make sure that everybody gets what they need from our IDES, and I will say that there's been a vast improvement. I watch the numbers. I get a report every day, and we are processing, I think 17 times the number. The last report I saw, 17 times the number in a single day that we did a single day last year. So just to give you a sense of the magnitude of the problem. And then similarly, a multiple of the calls that were being answered a year ago are now being answered now. And so we hope that people are able to use that process. And I think the vast majority of people are able to, but of course we want people to reach out. I would ask them certainly to first try to do it online. That is really the best way to get it done. It's going to be clunky to have a lot of people involved in the process. If you can avoid that, please do.
I imagine, though, you don't want everyone calling your office specifically.
It would be, I will say that's an unusual situation where we have the ability to intervene. Remember, the biggest issue is we can't look at their private information at the governor's office, right? We can't process for them. And so, so we have limited ability to really do anything except to hand it off back to IDES and, maybe get some attention to it.
Marianne Ahern, NBC5, a question about unemployment. When will the 13-week federal unemployment extension be implemented?
Mm-hmm. Sorry, the 13-week it is implemented. The people who have the extension on their unemployment, that's implemented now. So meaning that beyond the normal 26 weeks, it will keep going for people that hit the 26-week mark.
Marissa Parra, CBS 2. Summer camp business owners and parents say that they are waiting on official word from you to make a decision about whether summer camps will proceed or not. When can they expect that decision?
Well, I'm not making decisions about summer camps, the summer camps themselves, and I know parents will make those decisions. And I feel terrible not having a perfect answer for them because, as we've seen, you have to really watch all these numbers and see which direction we're going to know, to even begin to start to project when could you, and then of course, is it possible to do social distancing in the context of a summer camp? If people are, staying overnight, for example, or even in a day camp, aren't they often gathering in large groups in a summer camp? So I think these are all things that we'll have to watch the numbers and see how things are going. But I think people understand what the qualifications are going forward because COVID is still out there. It's still going to infect people, and so we're still going to need social distancing, even if we don't have a stay-at-home rule. You would still need social distancing. You would still need people wearing masks. You would still need, a lot of the things that might make it difficult to, for a summer camp to operate. But that doesn't mean the summer camp can't figure it out.
An extension of the stay-at-home order into June would directly impact that.
Oh well, again, that's not something that we're, that we're contemplating at the moment. I mean, we're looking at an extension, but I don't know. I can't tell you right now how long that extension should run. And again, as you've seen, we've had to extend the stay-at-home order. We put it in originally on March 21st. It went into effect, and we then had to extend it in April to April 30th because circumstances changed.
I only have 3 more.
Okay.
There've been a lot of emails here. Mark Maxwell from WCIA. Missouri's governor has said that he intends to reopen most of the state as soon as next week. Missouri, May 4th, he made a correction. Given that so many people in Metro East live and work in that same region, have you had any luck working with Governor Parson to convince him why that may not be a good idea?
No, although I think I've been very vocal. I think all the governors know where I stand on, what kind of a set of principles ought to be operated upon in order to think about reopening. It's why we created this Midwest Pact of states, and we reached out to Missouri. They were not interested in joining that pact, and similarly with Iowa. So, I can't stop, because we have no national strategy that everybody is following, that working, that works anyway for everybody. Individual governors are making their own decisions.
Amy Jacobson, WIND. A number of healthcare workers at Lurie Children's Hospital and Rush have either been furloughed or lost their jobs. When will you allow elective surgeries to resume? Governor Cuomo is allowing them starting next week.
Yeah, we're looking at that as we are in lots of other areas where, again, a reminder that when we put all these orders in place, and as, even at the beginning of April, we didn't know, how virulent this virus was going to be. How fast was it going to overtake a community, and therefore hospitalizations and so on, would rise. And so, we've learned a lot in that process. We've seen what's happened across the state of Illinois, the differences between one area and another, and so, taking that into consideration as, elective surgeries is one of the many things taken into consideration as we look forward.
You able to give us a couple more elective surgeries, just preview what you may in the coming days announce?
We've looked at an awful lot of things, and I've gotten suggestions from all across, both sides of the aisle of elected officials as well as all across industries, so we're considering a lot of different things.
And Tony Arnold, WBEZ, what is your reaction to the decision by the U.S. Department of Education that local universities can't give CARES money to undocumented and international students? Will the state provide additional aid to these students in some way?
Yeah, you know how I feel about that, so I think you know what my reaction would be. I've opened up the opportunity for people who are in our state, residents of our state, who, by the way, are taxpayers too, to be able to get some help going to college. I think that's very important, and so we'll be looking at all the ways that we can support people that are residents of our state.
Okay, John O'Connor at the AP. As you know, the House GOP outlined reopening ideas while people wear face coverings and continue social distancing that include opening businesses like department stores, salons, golf courses, and letting hospitals resume some procedures. Could you agree to something like that?
I think it's the same answer I just gave.
Okay. Shia at Politico. Mitch McConnell said today that he'd be open to letting states
shelter at home ordinances, or whether it be restrictions on movement throughout the community. I think it's these flatten this curve, because the models that would have predicted tens of thousands of deaths across the state, those models were informed based on data of how the virus usually would typically replicate if these interventions were in place. So by putting these interventions in place and not letting infected patients expose as many other potential patients, we've reduced the number of cases, and we've afforded the healthcare systems time to get prepared. And it's been quite an effort. It's been a lot of work. We've made some discoveries. We've done some things that we wouldn't have thought we would have ever have to resort to. But I can tell you that we're prepared. Specifically in Southwest Missouri, I can say that we're prepared for almost any rational type of scenario, almost any surge. We're also prepared for people to re-enter the medical systems for their routine medical care. I can tell you that now we have multiple test modalities, multiple platforms in place. We're working with several different labs. We're working on in-house testing. We have ICU beds and we have capacity. We have ventilator capacity. We have the personal protective equipment, whether it be the masks, the face shields, the gowns, and we have innovative ways to reprocess this equipment that never before would I have dreamed we would be reprocessing what is typically a disposable mask, but we have ways to validate these processes. We know they're safe. So we also have treated our first patient with convalescent plasma, and I'll talk a little bit about that. We've enrolled patients in clinical trials, and we're working with other healthcare systems collaborating. Cox and Mercy in Southwest Missouri have worked with Greene County Health Department to stand up a mobile testing unit, and for about 5 weeks, we're testing 60 to 80 patients per day, keeping them out of the healthcare system, providing quick 24 to 48-hour results. So it's this preparation that has allowed us the luxury of having conversations to even discuss reducing some of these restrictions, some of these statewide ordinances. It's because we've had this time and support to prepare. So I know that our health departments are strong. Our state has great local health departments. I know we're going to be able to monitor this disease as we move forward, as we relax some of these restrictions. I'm working with our local health department to monitor hospital preparedness. So the healthcare system's job is to be prepared. The public health's job is to identify infected patients, do the tracings, and monitor this disease as we move forward, as we relax some of these restrictions. I'm working with our local health department to monitor hospital preparedness. So the healthcare system's job is to be prepared. The public health's job is to identify infected patients, do the tracings, and isolate those, and hopefully mitigate subsequent transmission. So right now, these processes are stood up and ready to go. We're communicating with the health departments on a daily basis, and these are really exciting new developments that before this pandemic I was never part of. So knowing that we have excellent relationships with public health and the healthcare systems is encouraging. The other thing I want to emphasize is that we know that routine healthcare has to continue. So there are going to be non-COVID-based trickle-down consequences of people not seeking out their operations. These have been called elective procedures. I would prefer to call them medically necessary and time-sensitive. So people are going to have to resume their standard medical care, and we're aware of this. And so I want people to know that the healthcare systems are safe. We're taking exhaustive measures across the state to make these clinic offices safe, to make it safe for a patient to come in and have a procedure. And so people need to feel safe re-entering the healthcare system, and we're cautiously re-expanding our services. We're working with the health departments to monitor disease. We're monitoring our staff, our stuff, and our space. Those are the 3 S's that I like to use. And what that means is our personal protective equipment, our assets as far as testing, making sure our healthcare workers are well. And so I want people to know that they don't need to be afraid to reintroduce the healthcare system. It'll be different. You might sit in your car and you might make a phone call before you enter. You might be called in instead of sitting in a crowded waiting room. The offices are clean. The healthcare workers are being screened for symptoms. So I want people to be encouraged to reenter the routine medical care on a slow, calculated basis. Then there's 3 other things that I want people to understand. I want people to be flexible and understand this is a dynamic process. And as we release some of these restrictions and as the healthcare system starts to normalize again, there may be bumps in the road. We may see blips in disease, but we're going to be aware of those, and we're following those along with the health departments. And we may even have to resume some minor restrictions in movement as we release some. So if people will be patient with us, this is going to be a long haul. I know that lifting the shelter at home is going to be an answer to prayers, but this is all contingent on people around our state adhering to those same fundamental principles of keeping your distance from people, being aware of your surroundings, not going to work if you're sick. These little things like handling what's called convalescent plasma, and that would be where if a patient had coronavirus infection, they had the COVID disease, after a few weeks, when they're better, maybe 3 weeks, they might seek out a call to their primary care doctor or the blood bank or a local healthcare system and see if they would be a candidate to donate plasma. That would be like a standard plasma donation, except the thought is it has antibodies that might protect another patient. So the next patient that we have that's critically ill in the hospital, it would be wonderful if we had these tools, this plasma that's banked. And Dr. Williams in the health department issued a press release a while back, and so we're hoping people will start to consider, once your disease is resolved, donating plasma. The other things that I wanted to talk about are the things that have made me excited to be part of this healthcare system, part of the statewide mission. Reprocessing personal protective equipment, again, something I never thought we would do. We have support from the state. We're doing it locally. These were exciting new things that we're doing. We're making PPE. I think a lot of cities have brought in private business to make things like shields or gowns, and we're doing that in Springfield as well. And we're enrolling patients in novel drug studies, and we're learning as we go. So there is some hope. There are some exciting things that I think we're going to take on the back end of this. I'm encouraged about the humanity and respect that's being given to healthcare providers with this. So I want people to understand that on the end of this, it may be a bumpy road. Things are looking good. We have excellent statewide support, testing capacity, and I want people to know that there is going to be a brighter side on the end of this. That's all I had, Governor.
All right. Thank you, Doctor. Thank you very much. Dr. Trautman, when I was talking to him out in the hallway, he said that he's got some kids at home that are doing their homework today, but they're going to be watching Dad up here give his presentation today. So for you children of Dr. Trautman's at home, you should be very proud of your dad, one, for being up here today to speak to Missourians, but really for what he does for a living about saving lives across Missouri. And it was his action that did save lives across our state. So I want to personally thank him, and thank you for being part of that family that done that. We are encouraged by the recent data, which is why we feel we're in a place to move forward with our recovery plans and begin reopening our economy. As I said, our Show Me Strong recovery plan will be deliberate and data-driven. It will rest on four main pillars, including expanding our reserves of PPE. The PPE shortage has been a top concern in Missouri and nationwide as health professionals and first responders respond to COVID-19. Today, I am pleased to announce the deployment of a decontamination system in Missouri to assist with the N95 mask shortage. Starting next week, hospitals, healthcare providers, and first responders will have the opportunity to utilize the Battelle Critical Care Decontamination System to safely decontaminate N95 masks. Through this system, we will have the maximum capacity to decontaminate up to 80,000 N95 masks per day if needed. By helping conserve PPE, this will be a huge benefit to our overall recovery plan. Today, Director Richardson is here again to give us an initial update on our recovery efforts. Todd?
Thank you, Governor, and thank you, Dr. Trautman, for making the trip to Jefferson City. Your insights have been incredibly helpful to the state as we responded to this event. I'm excited today to talk about a few things that we're doing to tangibly aid not only in the fight against COVID-19, but also in how we get to a recovery. In the past week, major strides have been made to prepare Missouri for that safe and phased reopening of the economy. In alignment with Governor Parson's pillars of a Show Me Strong recovery, we are actively responding to the nationwide PPE shortage with innovative and new technology. As the Governor mentioned, next week we'll be receiving a decontamination system from Battelle Laboratories at no cost to the state of Missouri. The decontamination system is the result of 2 decades of research, and it's received approval through the Food and Drug Administration. The Battelle system is 100% federally funded through a FEMA and U.S. Department of Health and Human Services grant. This system uses hydrogen peroxide vapor to sanitize N95 masks up to 20 times per mask, and as the Governor mentioned, is capable of decontaminating 80,000 masks per day. The Battelle decontamination system will bolster our supply of necessary PPE and will be a critical component of allowing our healthcare system to gradually begin to perform postponed and non-emergent procedures. Most excitingly, this system will be functional next week. Additionally, on Monday, the Department of Economic Development, in consultation with a wide array of state government employees and private partners, has launched a personal protective equipment marketplace. The marketplace can be accessed at DED's website at ded.mo.gov. It will allow public and private sellers of PPE to connect with buyers and will help the state to determine supply and demand of all types of personal protective equipment. The marketplace will also help the state to project those critical shortages and, where necessary, purchase and distribute PPE to public and private healthcare providers. We're also working, along with the governor's pillars of a Show Me Strong recovery, to improve our testing capabilities and volume. We've partnered with Microsoft to launch a public-facing platform that will help screen Missourians for symptoms and connect them to nearby testing locations. Microsoft has provided this platform to the state of Missouri free of charge for the next 6 months. Together with community partners, public health experts, private sector leaders, your state government is building a foundation that will allow Missouri to effectively manage COVID-19 in the near and long term, and most importantly, will ensure a robust economic recovery.
Todd, thank you very much. I also want to mention today on the Battelle machine that I want to thank the federal delegation for their part in that, trying to make sure they're keeping supply. I talked to Senator Blunt, Senator Hawley yesterday, and the entire federal delegation. I just want to make sure people know that they're working up there every day to try to help us here back home, and I want to thank them for their part of what they're doing. Another essential pillar of the recovery plan is expanding testing capacity, and we are rapidly working towards this goal. Today, the State Public Health Lab is implementing new testing criteria so that we can expand our testing even more in the state of Missouri to meet the guidelines and the goals we've set out. Dr. Williams is here to provide more details and also to give an update on the WIC and the Department of Health Summer Food Service Program. Dr. Williams?
Thank you, Governor. First, I'd like to discuss some of the changes we have issued to providers today related to our testing criteria at the Missouri State Public Health Laboratory. DHSS has expanded the criteria for people who can be tested through the Missouri State Public Health Laboratory. This expansion recognizes our increased availability of tests and reflects our strategies moving forward as we move out of the acute phase to box in new outbreaks as they arise and to give doctors and other providers, like Dr. Trotman, a broader decision-making ability as to who gets tested. The new criteria allows us to do comprehensive testing, in other words, testing everyone, staff and patients, in congregate facilities for both staff and the patients, both symptomatic and asymptomatic. It also expands the criteria so that we can test more first responders. To not only increase the amount of testing that can be done, but also to increase access to those tests, more than 100 sites can be found throughout the state now, and we've added an interactive map of those locations to our website at DHSS. We are also in the process of validating serological tests and hope to make that available to the citizens of Missouri in the next few weeks. We will then have the capacity to do 175 tests an hour that's obtained by a simple blood prick of your finger. This type of test collects the blood and it detects the antibodies of a person and tells whether or not they've been infected, even if they didn't know it, with COVID-19. This test will be especially important for people who were symptomatic but didn't get tested at the time, such as first responders and others who are potentially around multiple patients who may have had COVID-19 and become infected without knowing it. I also want to take an opportunity to provide an update on WIC and dispel any myths that are out there during this pandemic. The Supplemental Nutrition Program for Women, Infants, and Children, known as WIC, is still running strong and actively supporting current participants and enrolling new participants who may now be income eligible due to job loss related to the COVID-19 pandemic. In fact, the WIC program served about 100,000 women, infants, and children in the month of March, enrolled 3,500 new participants. The WIC program not only offers nutritious food items to meet participants' specific needs, but also provides valuable nutrition education and breastfeeding support. Over 36,000 sessions of nutrition education were provided in March. And the United States Department of Agriculture approved a waiver to remove the federal requirement that participants have to visit the clinics in person through May 31st. This waiver allows local agencies to maintain social distancing and to serve participants who may be quarantined and unable to visit the clinic. Pregnant women, new mothers, and families with children from birth through 5th birthday can learn more about enrolling in the Missouri Wic program by visiting the Missouri Wic website at wic.mo.gov or by calling the participant support line at 1-800-392-8209. At the Department of Health and Senior Services, we also have our Bureau of Community Food and Nutrition Assistance, working diligently to ensure children have access to meals during school closures. This Bureau was approved for waivers by the United States Department of Agriculture to allow schools and other community organizations to begin operating the Summer Food Service Program earlier this year, in March, to provide children with much-needed meals. In addition, these waivers are allowing children to have the meals delivered directly to their homes or be taken and consumed off-site rather than eaten in a group setting. There are over 800 meal sites available in communities throughout the state, and we're incredibly thankful to all of those hosting those meals for Missouri's kids. A map of meals can also be found on our website. Thank you, Governor.
Thank you, Dr. Williams. Appreciate it very much. Kelly, let's go to questions.
All right, thank you, Governor. The first question is from John O'Sullivan, KMOV. On May 4th, what limitations on which business can reopen will be in place?
We're working on the policy and the guidelines for that, but I will tell you almost every business in the state of Missouri will be able to open their doors. People will go back to work. There will be some guidelines we'll have with that, but the majority of them will be open.
Do you see, Governor, limitations on the number of people that can gather at one time?
I think we will. I think there'll be guidelines for that, how many people can be in groups. Again, we're going to allow people to go there, but social distancing is going to be important. Just what you heard the doctor saying here, the expert in that, that's going to be a key role to how we move forward. And I think it's going to be important that we maintain that social distancing for some time. So there'll be guidelines we're going to give to the cities, the counties, across the state for state policy, and it'll be where people can get out again.
All right, thank you, Governor. This question also is from John O'Sullivan. Franklin County announced last night it will be opening up several businesses starting this weekend. Are you okay with that, knowing that its mortality rate based on number of cases and population is one of the highest in the state right now?
Well, number one, Franklin County has to make some of their own decisions, and we've always focused on those local level decisions to be made. However, the state order is still in effect till May the 3rd. So whatever those orders they had can be more stricter than what we had, but it can't be less. So Franklin County is still under the state order, and they'll have to follow those guidelines.
Thank you, Governor. This question is from Jason Hancock, Kansas City Star. Governor Parson, Senate Majority Leader McConnell said today that he'd rather let states financially squeezed by COVID-19 declare bankruptcy instead of extending the federal aid that would require further deficit spending. Do you agree that the federal government shouldn't step in to provide direct aid to states facing budget shortfalls?
Well, several parts to that question. Number one, I don't believe the states should file bankruptcy. I think the states should be responsible for how you spend your money. And because you did a poor job of managing it, whatever those states may be, I don't think the federal government should come and bail you out. So that part, I agree with what Senator McConnell said. I don't think the states should file bankruptcy. I think if you get your position into bad management, then the people of that state's going to have to understand they're going to have to do without a few things to get back to where you control it. It is one of the good things, one of the great things that I like about this state. Regardless what party you're with, we all know you have to balance the budget every year. You can only spend what you have. You can't spend more. And I think other states need to focus on that same responsibility, but it's not right for them to get bailed out, and then other states like Missouri that does it right ends up bailing other states out. That's not what the federal government should be doing.
All right, Governor, thank you. This question is from Brian Hosworth, Missouri Net. Governor Parson, Missouri lawmakers return here to Jefferson City on Monday and have just 3 weeks to finish their work. From your perspective, what are the top issues they should focus on when they return?
Well, I'm just going to tell you one, but they come here to do the budget by May the 8th. That's what they're coming back here for. That's their main objective. My understanding of that, and that's the one thing that we really need to focus on. If that's what they're coming back for, we need to try to get that budget done, if that's what their plans are.
All right, thank you, Governor. This question is from Dick Aldrich, KJLU Radio. This week, the University of Washington study estimated that we had reached the peak of COVID-19 infections and deaths last week, and that the curve of both should now start trending down. Does that go along with the metrics you were looking at, and are we trending down on new infections and death?
With all due respect, we made that decision over a week ago here in Missouri, and I'm going to go back to what I originally said that I thought was critical for our state and for all states, but I'll just say Missouri, having our own data to understand what's really happening in our state to be accurate. I get the predictions of a lot of people across the country that want to make predictions or want to make forecasts or models. I get all that. And I'm thankful that there was other doctors in other areas. I talked to Dr. Trotman before we come in here that give him some advice. But the reality of it is, I'm going to go back to what I said a week, 2 weeks ago. It is Missouri data that I'm going to make decisions on, not some prediction. We believe we were headed in the right direction over a week ago when we decided to lift some of the regulations we have and open the state back up.
All right, thank you, Governor. This question is from Ashley Bird from Learfield. Yesterday, Governor, you signed House Bill 1511 and 1452. Can you talk a little bit about that bill?
Yeah, it was the military reciprocity bill that we did yesterday. It was one of the priorities that I had going in this year, and it was fortunate enough to be one of the things that got done early in the session, one of the very few things that got done this year. But it really began, for our military families that come through the state, whether it's Fort Leonard Wood, Whiteman, wherever it might be, it was for the spouses of those military members that they can go to work when they get here so they don't have to, especially right now, let's just talk about nurses, for example. If you're a certified nurse, you could come into Missouri and start that job tomorrow if for the military family. Before, it would require maybe trainings or the licensing process, or it would cost money just simply to do that. The whole concept is when they come here, the number one concern the spouses of military families had is, are they going to be able to go into the workforce as soon as they get here? And Missouri, has always been a military-friendly state, and I thought that was something that we really needed to do, to have that full reciprocity. So if that spouse comes here, whether it's teaching school, whether it's a medical profession, whether it's an engineer, whatever it might be, that they can go to work in our state. And I'm proud that we got that done. I'm thankful for the legislatures for their work getting that done. But it's a good day for Missouri, and it's a good day for support our military when we do that.
All right, thank you, Governor. This question is from Alyssa Nelson, Missouri Net. Do you plan to select others to join your stimulus money informal working group to make it more of a bipartisan and diverse group?
I think we have. My understanding is, I was briefed by the administration earlier, I think we're going to there'll be a couple more Democrats on there. I think there'll be somebody from the Senate and somebody from the House that'll be on that. Here's the important thing, I think because we had this advisory group to come in here, I think people all of a sudden thought that they were going to have the say over where this money goes or how it's divided up or anything. That's not really the case. We picked the state treasurer because the money's going to flow through the treasurer's office, but this is really taking a look at the federal guidelines is going to tell us what we do with the money. They're just helping us get through the process of the guidelines, but they're not going to have the ability to be able to say we can send this money wherever we want to send it. That's not the purpose of that. I think for whatever reason, I think somebody had it got put out there, maybe the media put it out there thinking they were going to have the ability to do that, but they really don't. It's an advisory role is what they're at. So we're going to open that up to public meetings. There was some concerns about that. So we'll open it up and we'll put some more people on there. But again, I want to clarify what their role is.
All right, and the final question today for you, Governor, is from Alex Smith, KCUR. Fewer people are currently being tested in Missouri each day than were being tested earlier in the month. With testing numbers declining, how can we expect to reach the 40 to 50,000 tests per week that you said we needed to do by the end of the stay-home order in May?
Yeah, because I think everybody in this room, Dr. Williams, Director Richardson knows how important this is to me. And it's not about just the testing as of today. We got to be able to test large volumes of people across this state, and we're going to get to that point. The reason the numbers are low right now is because the criteria itself, and it's why I announced today, and Dr. Williams did, we're expanding that criteria where we can do more and more testing. Where we're going to give the providers the ability to just actually, if somebody walks in there, say, if you want to test them, you can test them. They don't have to meet the criteria. We have to open that up to go to different segments across the state. So we can kind of check whatever areas we might be, whether that's a Springfield, Missouri, or maybe that's small town Missouri, we can do sample testing. The other thing that's so important, why we got to be able to do more testing when we do have an outbreak or a hot spot, as we call it, a nursing home, we got to be able to have the resources and the testing capacity to go in there and isolate that right away, and to be able to figure out who the employees are, who the people are in those homes, and to be able to test that. And by doing that, we're going to be able to test a lot more people. And at the end of the day, we're on track to meet those testing guidelines, and I believe we will get there. And every day I'm going to push these directors as hard as I can push them to make sure we're moving up on those testing numbers.
All right, thank you, Governor. I have a couple of questions now for Dr. Trotman.
Okay.
This question is from Philip Sitter, the Jefferson City News Tribune. Dr. COVID-19 can obviously be fatal, but there probably are people who may not yet understand all of the nuances of this disease or of the pandemic generally, even as they've had to live with the consequences of social distancing. Can you summarize why unmitigated spread of COVID-19 is dangerous for everyone?
Thank you. That is a very good question, and I welcome that question because it helps us understand what a contagious disease is, what an infectious disease is. The person who is asymptomatic, who transmits the disease to the next person, may not suffer severe consequences. That person transmits it to a therapist that goes into 3 different nursing homes in a week, and you have very sick elderly patients. So what we look at is number one, the impact on the healthcare system from those people who may have mild disease. Some of them, some small fraction, maybe 10, 20%, may end up in the hospital. Some of those may end up on the ventilator, and some may die, despite not being advanced age or having multiple comorbid conditions. So this is one of those diseases where even the person who thinks they are young and invincible, there is a small fraction of those people that will have severe consequences. Those people also move about the community the most. Oftentimes, people who are asymptomatic shed the most virus. So it is not about looking at whether or not that one person will have severe consequences, as it is how much can they move about the community and spread it. And the odds are they will spread it to someone who would be more vulnerable. So I think it's important that people understand themselves. I know for healthcare workers, we've had to change our paradigm completely. We now look at ourselves as the potential source. Now healthcare workers in the hospital wear a mask. So now I look at my patient as being susceptible to me were I to have the infection and not transmitting it. So this disease has flipped the paradigm quite a bit. It's not just about preventing sick or people with comorbidities from coming into the hospital. What we've done, and we've done it in an excellent fashion, is we've prevented asymptomatic transmissions and pre-symptomatic transmissions in the community.
All right, thank you. Dr. Trotman, this one is from Lucas Geisler from ABC 17. What challenges has your hospital faced in getting a hold of PPE?
So that is 7 weeks of work, full-time work by a whole team at our healthcare system working with the local health department. I know Mercy's done the same. I'm talking to doctors in St. Louis and Kansas City. We've all suffered the same crisis in being prepared with PPE. We have not, personally at my hospital, we haven't had a critical shortage whereabout we weren't able to use standard of care PPE. But what we know is that there's a market, and anytime there's a market, there's going to be people selling things that may be inferior, marking up prices. So we've seen price gouging, we've seen items not exactly what they were intended. So N95 masks that wouldn't meet strict fitting criteria. We've struggled with testing reagents. When you hear about testing kits, that goes all the way from the molecular machine in the lab and the reagents to the tube, to the transport tube, all the way to the swab. And so every part of that supply chain has been affected. Even the labs that can do thousands of tests per day may run out of one simple little pipette. One little tube to draw up reagents could stop their production. So we have an entire team at our hospital that just works on the supply side of things. So again, we haven't had those crisis level deficiencies, but we're prepared for it.
All right, and the final question for you, Dr. Trotman. You may have to help me with this, the pronunciation of this drug, but have doctors at your hospital prescribed the Oxford chloroquine.
Hydroxychloroquine.
Thank you. To COVID-19 patients.
Sure.
And have you seen any hoarding in that industry?
That's a great question, and that's a timely question today because people will have seen the news that some preliminary data that haven't been published in print, haven't been peer-reviewed, show that drug's not as effective as we would have hoped. It could be harmful. We've known all along that hydroxychloroquine plus azithromycin can worsen or make new cardiac arrhythmias, even leading to death. So personally, in our system, we've used hydroxychloroquine sparingly because I was informed by the original data. I looked at the data out of France. Those were not very compelling to me. And knowing the side effects, the problem is it's a desperation. And so yes, we saw hoarding of the drug. We saw people buying drug off shelves. We saw it in short supply. Fortunately, we haven't prescribed a whole lot of it. We've tried it in desperation. But yes, that drug was the victim of some hoarding. Doctors, healthcare providers wanting to use it prophylactically, which it's not indicated. There's some new guidance that's out there from the federal government on actually saying not to use that for prophylaxis, meaning just taking it every day to prevent COVID. And there's no evidence, and we shouldn't be taking it just because we were exposed.
Okay, thank you. Dr. Williams, I have a few questions for you. This question is also from Lucas Geisler, ABC 17. What does the state need to make its boxing in testing strategy? What do they have to do to make it work?
Thank you, Lucas. What we need to do is to have the testing capability, and we're actually doing this as we speak. I was at the state lab last night, and it just gave you an idea of just how widespread this is to meet a group of couriers that came in from way down in the Boot Hill as the National Guard was taking testing sites to very northwest up in Andrew and Nottoway and Buchanan County. And so in that one snapshot, you had the two examples of the state where we were trying to box in. We have two outbreaks or potential outbreaks. And so we're going in now that we have more capacity to test, and we are testing everybody. We are testing staff, we're testing residents or patients. In one case, we're testing workers. And so that's where we want to get to forward. You heard that as we have more tests, we have the ability to do that. And so let's say in mid-May we have an outbreak in a nursing home or in a manufacturing plant or a congregated facility like a prison. We will be able to have the ability to go in and test everybody.
All right, thank you. This question is from Philip Sitter, Jefferson City News Tribune. The director of the CDC this week warned that a possible future wave of COVID-19 infections later this year could be made worse by the return of flu season. And he recommended that more Americans get the flu vaccine and get it early. What's the role Missouri can play in getting more flu vaccines available, and how soon?
Yeah, Philip, thank you. And as you know, only about 45% of Americans get their flu shots, and that's really not due to a lack of vaccine. That's just that they didn't do that. I think one thing from a public health perspective, we applied to this strategy about 2 years ago, our rate of getting vaccinated wasn't very good. So the governor and the first lady were kind enough for the last 2 years to lead up our campaign, and we increased the number of vaccinations by 15%, which I think was 150,000. So as we move into next year, it's just really important that the public health message get out. You really want to get your flu shot next year because for lots of reasons, one for your own self, but also certainly one thing we've seen tremendously is that as we've moved out of flu season here in Missouri this year, which was about 2 weeks ago, it very much helps our bed capacity, our ventilatory capacity. It helps our healthcare providers like Dr. Trotman. So thank you for thinking that far ahead, but we are really going to do a very robust campaign for people to get their flu shot next year.
All right, thank you, Dr. Williams. This question is from Madeline McLean, KQTV. Counties are beginning to run its new rapid testing through its ID Now machine. Per NPR, researchers at the Cleveland Clinic say it has a false negative rate of 14.8%. As research emerges questioning the accuracy of these tests, does DHSS support Abbott ID Now continues use?
We do, Madeline. I was on a conference call yesterday with the head of Abbott Labs and the Admiral Giroir and Ambassador Brooks, and At this point, we think that test is incredibly helpful. That data you mentioned, we've looked at. We will continue to validate it in our state public health lab. But at this point, we have confidence in that test to do what we want it to do, which is point-of-care testing that you can get back in 13 minutes. And we will probably run a small sample in which we also run that against our own labs in the state. But we have dispersed those machines, and we think they are a great tool going forward to get people, especially in that boxed-in strategy. We used it this weekend, to be honest with you, where we can go into a nursing home and quickly test staff or people that we're worried about, maybe they were in the room with somebody with COVID-19, and get back the results in 13 minutes.
All right, thank you, Dr. Williams. This question is from Sebastian. He asked, rural counties such as Saline and Montauk now have some of the highest rates of COVID-19 cases in the state related to meat processing plants. What is the state doing to respond to these outbreaks?
Well, Sebastian, you heard me mention earlier that the National Guard was taking a bunch of tests up to northwest Missouri last night when they met us there, and that is what they were doing. We identified a potential, some cases, and so we instituted our boxed-in strategy there. You know, when you bring up rural Missouri, as you know, 50% of our cases have been in 2 counties, and much of it mirroring the nation's experience has been urban. But what we know is this, is that if you look at that, we're already seeing in rural Missouri an increase in cases as we plateau in other places. And when we look at those, the thing we get concerned about is those patients tend to be older, and they also can have more chronic health diseases, so we worry about their outcomes. The ones that we've seen so far, I looked at it this morning, are also tend to be associated around work, and people working in close proximity to each other. And that's probably different than what we're seeing in St. Louis and St. Louis County and Kansas City. So we're paying very close attention to work site kind of congregated facilities in rural Missouri where people, by the nature of their job, work very close together. And so rural COVID-19 is different in the way we approach it probably than urban. Thank you for the question, though.
All right, thank you, Director Williams. This question is from Rudy Keller, Columbia Tribune. Last week, Governor Parson said Missouri must increase testing to 10,000 a day, and that the state was performing about 3,000 tests a day, and that the numbers would, quote, double our capacity right now in the next week, and I think that is doable to do on that. Actually, the state hasn't reported more than 2,000 tests on any day in the past week and has fallen behind Arkansas, Illinois, and Oklahoma in testing per capita. What is keeping Missouri from meeting the goal that was set last week?
Yeah, well, right now we have the capacity in Missouri to do 50,000 tests a week. We can do that through our 16 labs if we needed to do that. What you're seeing is division here in that, let's take Illinois. We were doing more tests per capita than Illinois, but Illinois' curve continues to go up. They continue to have more sick people. And so the numbers you're looking at reflect symptomatic people. Those are people who are sick. And so the numbers you're mentioning are a great reflection that we don't have as many sick people. But to the governor's point earlier, we've now, as of today, about 3 hours ago, broadened our criteria. And we are now going to be looking at broader scopes of people other than people who just have coughs and fevers. And as we do that and we do more boxed in and what we call sentinel testing, in other words, we will increase our test numbers because we have the capacity to do that. And we think that's really important as we move away from the acute phase to a recovery phase.
All right, and the final question for today is from Joe McLean, ABC 17. It's kind of a follow-up question regarding Saline and Montauk County.
Yeah.
What, if any, conversations have been had with the local health departments in those counties?
I've had numerous conversations with one of those counties because, again, similar to what I said before, they have an industry there in which they've had a spike in cases associated around that industry. So one of the things we're planning to do is to move one of our Abbott machines to that county so that they can do rapid point-of-care testing. We also have something else we're going to unveil next week in which we will be moving into at least one of those counties, if not both of them, because we have seen a spike in both of those rural counties, and we're going to be doing a fairly intensive robust, targeted testing in those two, in at least one of those communities I know, to increase our testing there to get at what might be the underlying cause of that.
All right, thank you. Governor?
Thank you.
It is because of Missourians' quick actions that combat COVID-19 that we are in a better place today. Missouri has predicted to be much worse at this point in time, but because we have been aggressive in our COVID-19 response from the start, we have drastically improved these predictions and are able to move forward into the economic recovery phase. On Friday and throughout next week, we will continue the specifics of our plan for May 4th and the guidelines that will be in place as we move forward. We are hopeful about the future and look forward to seeing Missourians safe, healthy, and back to work. Before I close today, there was an article wrote in the St. Louis Post-Dispatch. And if all of you remember, I've never really said anything about the media since I've been behind the podium since I become governor. But one of the most disgraceful things that was in a paper today in our state was when the editorial board of the St. Louis Post-Dispatch referred to all Missourians outside of that region as simple-minded rural Missourians, which makes up a vast majority of the people in this state. When bias outlets like that do things like that at a time of crisis, when people are dying, when everybody is trying to work together to make this state better, it is one of the most disrespectful articles I have ever seen in my career to refer to people of this state, because we are Missourians. All of us are Missourians, no matter where you come from in this state. And most of us are all proud of it. And people work hard all over this state. But for some media outlet, and again, I want to be clear that I'm talking about the St. Louis Post-Dispatch that wrote that article, to talk about people in that disrespectful way should be held accountable, and I hope they are someday by the general public, to make sure they understand that they have responsibilities at the jobs they do also. Thank you, and God bless.